All right, we're back with another question. This question's about supporting the body and mind in pregnancy and postpartum. Let's listen to Riley's question.
Hi, I am Riley. I am a perinatal mental health therapist. So I wanted to ask what would be the best way for clients to help their bodies and their minds to be supported both throughout their pregnancy but also postpartum. So like what kinds of supplements, foods, that kind of thing would be most beneficial for them to work into their diets to decrease their risk of having perinatal mood disorders.
Great. So I'm doing this new series where I'm answering your questions and in hopes that I can help other women and other people going through similar journeys. So Riley, thank you. I love this question because it's exactly the integrative approach we need more of. Let's dive in. So first, it's important to know the perinatal mood disorders like postpartum depression or anxiety don't come from just hormones, right? It's a mix of hormonal shifts, nutrient depletion, inflammation, leaky gut, stress load, and sometimes a small part of genetics plays a role as well. So when we can support both the mind and the body, we profoundly lower risk. So what are the key nutrients and supplements? There are some that are foundational in my practice when I'm working with my moms that are pregnant or postpartum. Omega-3s, triple strength fish oil from Select Balance is my favorite, especially with DHA. It's crucial for brain health, mood balance, and a baby's brain development. Choline is one of my top favorite vitamins that helps with memory, mood, and nervous system health. So not only is it helping mom, but it's also helping with baby's brain development as well. Magnesium glycinate or threonate are both really highly absorbed magnesiums, and they can help with relaxation, sleep, and decrease anxiety. So I always have my patients take either magnesium glycinate or magnesium threonate before bed just to help relax them. A good rule of thumb is take your B vitamins or your vitamins in the morning and take your minerals in the evening because minerals are more calming. B vitamins are more energizing. Another supplement, I love B complex. So you're getting the whole line of B vitamins with B12 that can help with methylation, energy, and nervous system support. So with this, for my typical woman that I'm seeing that is trying to conceive, pregnant, or postpartum, I have them take pregnancy support, prenatal completes. So that 2 capsules daily, you're getting all methylated vitamins in a high quality form. So we do that from Select Balance, and it just really helps moms. And then probiotics, or I like IBS support because let's admit, a lot of Americans have leaky gut and we don't even know it. We're walking around with inflammation in our gut, which is part of the gut-brain axis. So up to 80% of our neurotransmitters for our brain is produced in our gut. So if our gut is inflamed and leaky and not working the way that it should, then we're having disconnections from our neurotransmitters. So having IBS support helps with having marshmallow root, licorice root, other supportive nutrients that can help ease the gut lining and help repair. And then probiotics can also help with that as well. And then vitamin D. Vitamin D is associated with mood and depression and anxiety. So I always have mamas check their vitamin D levels. And if they are pregnant, I still supplement them at high doses to get them back up to good levels because, again, it is linked to higher mood disorder risk. And as always, especially when you're pregnant, I hope that you are going and getting these labs and getting individual plans from your providers. If your provider is not able or not willing to look in depth at labs, get someone that will be, because this is really important. And if it's important to you, you need to find a provider that is willing to support you on your journey. 3, nourishing foods. Food is medicine here. So I encourage high fatty fish like salmon or sardines. Again, this is loaded with omega-3s like fish oils. Eggs with yolks because they contain a ton of choline and healthy fats. Leafy greens also help with folate and magnesium as well if your body's well at adjusting and absorbing them. And then nuts and seeds. Again, be careful. If you have leaky gut, sometimes nuts are hard for our bodies to digest. You'll know. If you think I'm just going to eat a whole bunch of nuts because that's what I'm told to do, but you feel yuck after it, don't do them. Sometimes it's better to use like nut butter an organic, high-quality nut butter that's already broken down so that your body has less to digest. And the reason that they are good because they contain selenium, zinc, and magnesium. And then a staple, if you love bone broth, lentils, lean proteins are really great for neurotransmitters in the body. In some women, again, some don't. It just depends on if you have leaky gut or not. But fermented foods like kefir, sauerkraut, kimchi for gut health can be really beneficial. For myself, with a history of Crohn's, I do okay with sauerkraut, but like kombucha or other prebiotics, I have to be really careful of because it can be too harsh for my gut. So again, I'll give these recommendations, but you have to do what feels good to your body as well. And then really, especially when you're pregnant, stable blood sugars. So smaller, frequent meals with protein, fiber, and healthy fats can prevent crashes and spikes. If you're fasting 12 to 16 hours from bedtime to the first breaking your fast in the morning, that's totally okay too. Again, everybody's bodies are different. If you're not pregnant, I love Mindy Pelt's Fast Like a Girl routine, where it shows when you can really go into like the 72-hour fast and when in your luteal phase and later on in your cycle that you should be carb loading and not doing the fast like the 72-hour fast. So when you have stable blood sugars, it can prevent crashes that spike anxiety. And then lifestyle and emotional support. Sleep hygiene is really important. I know it's a lot easier said than done, but as much sleep as you can get postpartum is really helpful. I remember when I learned that I was pregnant, postpartum was where I immediately went. I'm like, what can I do to be successful postpartum? I didn't know that I was going to have flares and all of the health history that I ended up having. But what I did was I made sure I had nourishing meals, a bunch of bone broth in the freezer. I made sure that I booked Alex massage appointments every 4 weeks because I knew that if I was going to be taken care of, if I was going to get my sleep, he needed to be on top of his game too. So really, it's about having really good partnership postpartum and having a plan in place so that you both know how to kind of adapt to the stresses that the joy of a baby brings. And then gentle movement when able, walking, stretching, yoga, and social connection, asking people for help. I think my girlfriends and I always talk about what happened in our society where we lost community, where we thought and where we think that we have to do everything alone, right? It's like we wear this badge of honor that we can do all these things alone without support, but it's not how it was meant to be. It was meant to be where our community was able to lift us up. When we all go through cycles and seasons of being high and strong and on top of the world, and then we go through cycles and seasons where we're low and we need someone to help us. So why can't one of our friends or community members that are at their top of their game help us when we are going through a new transition? So community is key. If you know someone that just had a baby, that's pregnant, that is struggling with anything, if they're a caretaker going through and their loved ones are sick, please reach out to them. If you're doing well, give that to someone else. And then mind-body practices, especially when we're talking about mental health. How can we not talk about breath work, mindfulness, journaling, and going to licensed therapists that are really good at their game? I love like EMDR therapy, brain spotting, other modalities that get into the subconscious of our mind. I like talk therapy. I think it can help some people, but some people it can re-trigger traumas and not actually help them process through. So what is your therapist doing for you that's actually getting to the subconscious and rewiring those limiting beliefs that you have? I will say if someone is struggling with PMDD, like right before they get their periods, or if they're postpartum and they're having significant postpartum depression, doing ketamine therapy, I do that at my clinic. There's clinics all around the US that do that. I think it can be a life changer for women that are really struggling. So put that on the table as something that you are willing to try if you aren't able to help yourself with everything else. And then testing hormones. I really, especially postpartum, progesterone and estrogen are really trying to normalize. And when that happens, a lot of times our progesterone dips really low and can lead to increased depression and PPD symptoms. And I know that Riley does this as a practitioner, but I always remind my clients that it's really important to plan for your mental health before and after birth. Riley, thank you for your beautiful question, and thank you for the work that you do for supporting women. If anybody's found this video helpful, please share it with your clients, your community, and anyone else walking in the pregnancy and postpartum journey. We rise by lifting each other up. Until next time, thank you. Sending all the love to the mamas. You guys are not alone. You're doing incredible. If no one has told you that lately, you are doing an amazing job. If you have any other questions related to health, please go to thehealthypractitioner.com, leave your name, where you're from, and ask your question. I look forward to helping others on their healing journey in the community. Thank you.